is now called to order. Will the clerk please call the roll?
Fretham,
Here.
Modis Castillo,
Here.
McDonough,
Here.
McGuire,
Here.
Ortega,
Aye.
Reinhardt,
Here.
and Carter.
Here. Thank you very much. We'll ask Commissioner Ortega to say the Pledge of Allegiance for us while the rest of us mute for sound quality.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, in liberty and justice for all.
Thank you very much, Commissioner Ortega. The agenda of our November 23rd meeting is before you for approval. Is there a motion?
So moved, Madam Chair. Oh, second.
Thank you, Commissioner Ortega and McGuire. Are there any questions or discussion on the agenda? Thank you. Will the clerk please call the roll?
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Modis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
and Carter.
You're on mute.
Our agenda is approved. Thank you very much. And now the minutes from November 16th are before you for your approval. Is there a motion?
So moved.
And a second?
Victoria.
Second.
Thank you, Commissioners Reinhardt and Modis Castillo. Is there any discussion on?
It was actually Commissioner Fretham that seconded.
Oh, thank you, Commissioner Fretham, for your second. Is there any discussion on the minutes? Will the clerk please call the roll?
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Modis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
and Carter.
Aye, thank you. The minutes are approved. And we have the opportunity now to move into a couple of recognitions and celebrations. We'll begin by calling on Commissioner Modis Castillo for a proclamation recognizing Native American Heritage Month. Commissioner Modis Castillo.
Yes, thank you, Madam Chair. It is my tremendous honor to present on behalf of the entire board the Native American Heritage Month proclamation. We are joined by community members who can turn on their cameras if they're on. Bobby Joe Potter and Micah Barrett will be accepting this proclamation on behalf of those present. And so I'll read the proclamation and then I'll tell you a little more about Bobby Joe and Micah, who are tremendous partners with the county. So the proclamation reads, whereas the area within Ramsey County on American Indian ancestral and contemporary land that was and continues to be home to American Indian people. And whereas the original homelands of American Indian people within the county existed since time immemorial, and Ramsey County acknowledges the contributions of American Indian people prior to its formation. And whereas the American Indian community has historically been left out of conversations involving relatives where their advocacy was not properly handled or heard. And whereas Ramsey County recognizes the mass displacement of American Indian children from their relatives and communities due to the bias of government systems across the nation that have history of practicing elimination techniques to dismantle the American Indian race within America. And whereas Ramsey County benefits when it partners with community members and tribal nations on issues affecting American Indian communities. Whereas Ramsey County partnered with the American Indian community to hire 2 American Indian women in 2021 who have a passion to lead its Indian Child Welfare Unit with the goal of creating a strong partnership with the American Indian community. And whereas this partnership with community will result in culturally specific services that minimize and eliminate systematic racism and discrimination against American Indian families directly involved with the child protection system. And whereas Native American Heritage Month is a time to educate the broader public of American Indian past and present experiences involving colonization, genocide, violence, oppression, and relocation to begin the truth and reconciliation process involving American Indian people who suffered colonization, and to celebrate American Indian culture, history, resilience, and contribution to the overall Ramsey County community. And whereas during Native American Heritage Month, Ramsey County recognizes the American Indian community in their strength, resilience, tribal sovereignty, and advocacy while committing to serve the American Indian population who reside within Ramsey County. Now, therefore, be it proclaimed, the Ramsey County Board of Commissioners recognizes November 2021 as Native American Heritage Month in Ramsey County, and be it further proclaimed, the Ramsey County Board of Commissioners encourages all residents of the county to join in recognizing and celebrating the contributions and the important presence of the American Indian communities in Ramsey County. Now I would like to just introduce the folks that we just mentioned in this proclamation who are doing this work. And I also think it's really important that we acknowledge that we have a holiday this week, and that I really encourage everyone to take time and recognize and celebrate Thursday as Native American Heritage Month in your family celebrations as well. So with us today, we have Bobby Jo Potter, who is the manager of the Indian Child Welfare Program in Social Services. She's a citizen of the Boys Fort Band of Ojibwe, affiliated with the St. Croix Chippewa Indians of Wisconsin, and a current Ramsey County community member. Bobby Jo has been working within the county systems for over 13 years, serving in a variety of positions, having worked in child protection case management, SSIS mentoring, post-permanency case management, initial intervention and intake, specializing in an Indian Child Welfare Act, supervising an Indian Child Welfare Unit, and recently joining Ramsey County in a manager position overseeing Indian Child Welfare work in strong collaboration with the American Indian community. We're happy to have Bobby Jo. And joining Bobby Jo is Micah Barrett, who is the Indian Child Welfare Specialist within Social Services. She is from the Red Lake Nation and affiliated with, this is one LCO of Wisconsin. She can tell us how to say that because it's French and I don't speak French. And the Fond du Lac. Micah was born and raised on the east side of St. Paul and has been an active member within the urban Indigenous community. Micah joined the ICWA team on the 1st of November, previously working for her nation as a team lead social worker, acting as an advocate for urban Red Lake members who are involved in child protection system across the state and nation. She was also qualified expert witness for the tribe. Micah comes from a family who fought hard to make ICWA a reality for Indian people in the late 1970s. Her great aunts were writers of the Minnesota Indian Family Preservation Act. As a third-generation social worker, Micah has dedicated her life's practice to the Anishinaabe people in hopes to address historical and generational traumas that affect Indigenous populations. So welcome both Bobby Jo and Micah to Ramsey County's team and to our team here celebrating an American Indian Heritage Month. I'll turn it over to you.
Thank you, Madam Chair and Commissioners. It truly is an honor to be here today. And every time I've read that proclamation and just hearing it today coming from somebody else, I can't help but think of how beautiful the future is and how it looks for us as Ramsey County staff, but also for our community. Truly, we wouldn't be here today if it wasn't for our community's contributions to this nation, state, and county. And so I'm very grateful for their advocacy and for their continued showing up and trying to create tables. And here we have an opportunity to really embrace the American Indian culture. And I've seen that through the actions that Ramsey County has taken. And so it doesn't wipe away the entire history that our community has experienced here, but it's a step in the right direction. One of many steps that have already been taken that I've been a part of and experienced since I've been here. And one of those steps that I really have appreciated the opportunity to look at our hiring and bring in people from our community to help lead this forward. And so I'd like to turn this over to Micah Barrett because she is also a product of this embracing of Indigenous people and our ways of knowing and thinking. And we'd like to create this system to better serve our community. So go ahead, Micah.
Miigwech, Bobby. Thank you, everyone. Yeah, I guess it's been an honor to be a part of Ramsey County. This has been my community since I was born and raised. My mom and dad are advocates and servants to our Indigenous community, and it's really paved my way to where I am today. I just am really grateful for everyone and listening to us, giving us the opportunity to produce a proclamation, including voices from our community. And I have a really good feeling here that we're going to make positive, productive change here within Ramsey County, specifically within Indigenous communities and across the child protection system. So Chi-miigwech, a big thank you to you all. I appreciate your time.
Chi-miigwech, thank you so very, very much. We are just honored to have you here on the call with us today. Thank you, Commissioner Maris Castillo, for the reading of the proclamation and recognition that you provided. And thank you so much, Bobby Joe and Mika, for sharing with us. I love the thought that the future is so beautiful, not that it erases the past, but that it allows us to truly work together to embrace our Indigenous communities and ways of living together. You know, albeit we are here on Indigenous land unrecognized, not that we came initially here to share in that Indian way of sharing together, but in essence, to have appropriated. This is a new day, and we are working together in a new way. And we are so thankful for that work that we are doing together to ensure that the future is beautiful. I may have additional comments from other commissioners. I'm looking to see. I think we all embrace the future together with you. I do have Commissioner Reinhardt, who will speak on all our behalf as well. Commissioner Reinhardt.
Thank you, Madam Chair, and thank you, Bobby Joe and Mika, for being here representing the community. And I just have to say, Commissioner Maris Castillo, I will take to heart what you had said when we do our Thanksgiving prayer on Thursday. I will definitely include the celebration of the first Thanksgiving and of Native American Heritage Month. What a wonderful thought. And we need to do that every day, but especially this week and this month. So thank you.
And thank you again for that, Commissioner Maris Castillo. I see a lot of nods here on our camera, and I don't doubt that there aren't so many nods in our community as we will work together to ensure that we are celebrating that first Thanksgiving and our American Indian communities. Are there others here? Thank you so very much. It is a delight to have been able to recognize this month together. And we will now move on then to a second presentation. Once again, Bobby, Joe, and Mika, thanks for being with us. I am delighted to be able to share with you that last Friday, I was at an award presentation from the American Public Works Association in recognition of a project here in Ramsey County. I was delighted to be able to be there to share with staff who walked up to accept the award for an amazing project, the Dale Street Bridge. I was excited to be there and to see our team recognized for some creative and innovative and transformative work that has been done for our community in the Rondo area, but impacting our entire county and setting an example for public works transportation projects throughout our state, throughout the country, throughout the world. Recognizing that this is a project that flowed following our adoption of our All Abilities Transportation Network priority. It prioritized equity and community engagement and focus not only on safety and accessibility for vehicles, but for all of us, first and foremost, for pedestrians and bikers and those in wheelchairs even. And on connecting, I should say reconnecting, a community that had been separated by the I-94 project through the Dale Street Bridge in its artistry and aesthetics, in all of its features for safety and accessibility. It works to value our community, both those who are parts of legacy communities of the past and present, and those who are newly with us. I want to thank the leadership and staff for the different way of doing things, but first, I should call up our representative who is here from the American Public Works Association to confer the award. And so together with Mr. Richard McCoy, a Robbinsdale city engineer, I'll also call on, in fact, we already have both Mr. McCoy and our Director of Public Works, Ted Shaneker. And so first, I'll turn it over to you. Thank you so much for being here for the recognition, Mr. McCoy.
Well, Chair Carter, Commissioners, Manager O'Connor and Executive Team members, good morning and holiday greetings to you all. As mentioned, my name is Richard McCoy and I am the Public Works Director and City Engineer for the City of Robbinsdale. And while that might be in Hennepin County, I know you won't hold that against me. I'm here this morning in another role, and that is being the Vice Chair of the Awards Committee for the Minnesota chapter of the American Public Works Association. Thank you for allowing me to attend your board meeting this morning to recognize the recently completed project within the county. An important part of the work we do in public works is to celebrate achievements and to recognize the projects that benefit the communities that we serve. The Awards Committee helps to facilitate this recognition with a local awards program and with identifying projects for submission to the awards program at the national level. The committee also likes to highlight the achievements of winning projects with their agencies. This year, in response to the call for local projects, the committee received 13 very diverse nominations from metropolitan and outstate agencies for Project of the Year. The committee reviewed these submissions and felt that 3 projects should be recognised with an honourable mention. And I'm very pleased to advise that the Dale Street Bridge was a recipient of one of those. Some of the key elements that impressed the Awards Committee, and Chair Carter kind of touched on a lot of these too. The improvements to pedestrian mobility and safety, in addition to better traffic operations. The extent of community consultation and involvement that helped to create a unique blend of art and engineering. The detail in the bridge design that acknowledged the diversity of the area and the respect that has been paid to the Rondo neighbourhood displaced by the I-94 construction some 60 years ago. Also, as mentioned by Chair Carter, the award was officially presented last Friday at the Earl Brown Centre as part of the chapter's fall conference. Normally, I would be part of that in presenting the awards. However, I happen to be out of state at my son's national soccer tournament in Alabama, so that took me away from my regular job of handing out the Project of the Year awards. So, on behalf of the Minnesota chapter of the American Public Works Association, I reiterate congratulations to Ted and his team and to everyone at the county for this wonderful and worthwhile project. Thank you.
Thank you so very, very much for the features of our Dale Street project that you have recognized. Thank you for recognizing them. We are sorry that we didn't see you at the presentation, but we certainly understand that you had to be there for family. Thank you for coming here to bring the award forward. And I also have Ted Shaneker, Director of Public Works, on the line. And I know that you have a number of people who were involved in this project watching us on our website today. I'd love to give you the opportunity to share some thoughts in recognition of the team. Thank you, Ted, for being here.
Thank you, Chair Carter, Commissioners. Appreciate the opportunity to be in front of you for this project, and thank you to Richard and the American Public Works Association for recognizing our Project of the Year award here. We have the plaque that we get to put up here at Public Works, recognizing that effort. And both Chair Carter and Richard really highlighted what this project really meant to the community. And I mean, there's never a time where you're not excited to be in a room full of 200 engineers and public works directors. So Commissioner Carter, I mean, that was a blessing in itself just to be around that kind of royalty of engineers and public work directors across the state. Like you said, we had a lot of people that were connected to this project that did work on this project. And as soon as you start naming names, there's likely others that are going to be forgotten, but there are key individuals who had big roles or big responsibilities in this project. And I just want to highlight a few of those as a part of this. So from Ramsey County, we had Luke Lordy, our construction engineer. We had Dan Bodelson, our construction inspector. John O'Phelan out of Workforce Solutions. Allison Winters through our communications group. Matt Christensen was the TKDA project manager on that, from design all the way through construction. Micah Anders was the construction community engagement specialist that we brought in as a part of this project. And Nate Larson was the project manager for Redstone Construction. And then we had our partners with St. Paul and MnDOT as a part of this also. And like I said, there's many others that we probably could recognize, and we would probably take up more of this meeting to do that. We had community members, artists, other partners through FHWA, county commissioners involved. And I just want to say, Chair Carter, that your leadership and your involvement and your participation in this is one of the reasons why this project was so successful. So thank you for your partnership in this project too. And the rest of the commissioners, you know that we have projects in your districts. We have big things going on, and we're going to continue to do great work for you, for the residents, and for businesses of Ramsey County. So thank you.
Ted, thank you so much for sharing those thoughts. Thanks to all who are on the line who have participated with us. And thank you to all in the community who leaned in to make this the project it is. And last but not least, great thanks to our Board of Commissioners and staff leadership for the adoption of the All Abilities Transportation Network policy. It will be formative and transformational for everything that we do in our community. We are so glad to have had the chance to recognize these two, the Native American Heritage Month and also our Dale Street Bridge. It's great to celebrate our residents, our staff, and the work that we do together on a regular basis. This is an example. Thanks again, Ted, for being here with us. And thank you so very much, Mr. McCoy, for the presentation of the award.
Commissioner Carter, you've put yourself on mute.
I don't know how I did that. Thank you so much for catching me. And so we're going to move on then beyond the presentation of awards to our COVID update. I will call on County Manager O'Connor for that.
Thanks, Madam Chair and Commissioners. Let's stay on the awards. It's a slightly rosier picture than some of the COVID update, as you'll hear from Public Health. I'll actually kick it off. I just have one quick item today, and then I can go to the Public Health team and they can round through everything and we can take it all together. In our work around flexible workplace policy implementation, which technically began on November 1st, and the return to office phase 1, which started in a remote first environment because of the current rate of transmission. Through that process, one of the things that we knew we would gain through this is more documentation and understanding of our workforce, who qualifies or classifies as a primarily on-site employee, as an employee who is community embedded mobile, and what share of our workforce is eligible for hybrid work under the new hybrid flex work policy. And by way of reminder, even for people who qualify as hybrid eligible, they can select to be in the office full time if that's what better accommodates their working environment. And so there's some options, but it starts to give us an understanding of what our workforce looks like. We've never had shares broken out by these categories. And the chair and I spent some time last week where I was giving her a pop quiz on what do you think each category would have in it. And I did this to myself too. And I would encourage you just quickly to think about what share of our workforce do you think is classified as primarily on site, for example, out of our 4,000 plus employees. It turns out initially, our largest share of our workforce is primarily on site at 46%, classifies as in a primarily on site working role, meaning 4 days or more per week on site required to discharge duties. Something like in public works, a driver would be one of many examples of that type of designation. But we have obviously many different areas across the organization that fit that. Coming in next on those designations, 41% of our workforce classified as eligible for hybrid work, meaning 2 or 3 days on site discharging duties, and then the remainder of time in a more flexible environment discharging duties. And then 13% of our workforce classified as mobile or community embedded. We have financial workers in those spaces. You can think about assessors as individuals who are on site a day or less a week as they spend most of their time out in the field. These numbers aren't meant to say much else other than they tell us a little bit about who we are in a way that in the past we did not necessarily have available to us. I do anticipate over time, as the organization becomes more comfortable with designations, workflow, outcomes, and what that means, we'll see some changes around the margins to those numbers. But the last takeaway that I shared with the chair last week is it does get to the heart of why crafting paths forward together as an organization can be so challenging, because we work in very different environments across our 4,000 plus employees in the different ways we discharge work. And so in a week of Thanksgiving, my gratitude and thanks go to employees across this organization for continuing to speak up and be heard through the process, to be flexible and come along with our work, to share their perspectives individually and through their departments. We do this together as a team in service to the broader community. And we know that a more flexible, nimble organization is one that can be more service oriented and more employee friendly. But at the end of the day, it's a continual process of learning and development and growth. So thank you for letting me share those numbers with you from the outset. I'm going to turn it over to Director of Public Health, Sarah Holly, to move us into the health side of our update.
Thank you, County Manager O'Connor. I'm going to actually hand it over to Incident Commander Laura Anderson to kick us off. Thank you.
Good morning, County Manager O'Connor, Chair Carter, Commissioners. I'm going to ask Mike Lindsay to briefly share the CDC dashboard. Just a reminder, this past July, we were sitting at about 54 cases per 100,000 here in Ramsey County. As of just yesterday, our case rate is around 392 per 100,000. Positivity is fluctuating between 9 and 10% here in our community. Those are very concerning rates of positivity. I will ask Mike now to show our situation update, which has recently been revamped. Many thanks to Christine Grill and Tommy Godwin. They've spent a lot of time reviewing and revamping our existing dashboard to include this type of information from the Centers for Disease Control and Prevention. So here you can see where Ramsey County sits in terms of community transmission. We did go ahead and add the rest of the 7-county metro, just so that we could fully describe where we sit in terms of case rate and positivity. We're quite far away, unfortunately, from our goals around moderate or low transmission in our community. Mike, I'm going to ask you to scroll down a bit further. Tommy Godwin, thank you very much. And Christine Grill, again, have added some new information, which I wanted to highlight briefly. You can see death data across time here in Ramsey County. And the reason that I'm sharing this graphic with you is that I think it very clearly demonstrates the protective impact of vaccine. You can see deaths last November. You can see, although our data is incomplete for this year, you can clearly see fewer deaths occurring in Ramsey County this year. And again, we think this is in fact due to vaccine uptake, specifically around older populations, more vulnerable populations. Mike, could you go ahead and switch over to our vaccine dashboard? Just a quick reminder that eligibility has changed here in Ramsey County. We are now able to provide vaccine to populations as young as 5. Currently, we are sitting at about 74% of all residents having received at least one dose of COVID vaccine. Again, that's for populations ages 5+. We expect that percentage to increase perhaps 1% a week. We have certainly seen that that 5 to 11-year-old cohort, many of them are eager to get vaccinated, but vaccine uptake is a little slower than it was among 12 to 17-year-olds. Mike, I'm going to ask you just to scroll down to our summary. You will see a nice uptick in our numbers as of last week. Our vaccine team went above and beyond our goal of 1,200 doses. They actually provided 1,444 doses through 9 vaccine clinics, as well as across our existing client services. We intend, again, this is our Thanksgiving week, but we are still actively providing clinics. This week, we will administer about 1,200 doses. So just in summary, about 74% of our residents 5+ have received at least one dose. 80% of residents 12+ have received at least one vaccine dose. But we look forward to seeing those numbers increase through the end of the year. And now I'm going to go ahead and pass the mic over to Director Holly. Thank you.
Thank you, Laura. Good morning, Madam Chair, Commissioners, County Manager O'Connor. It's great to be back here with you. I have a number of updates. And first, I want to extend my gratitude and thanks, as Ryan has, to our public health staff and healthcare workers, not only in Ramsey County, but statewide. The White House COVID-19 response team hosted a thank you event for public health yesterday online. And so I hope many of our staff were able to attend that. It's also recorded, so I can most definitely send that recording to you all after our COVID update this morning. This event acknowledged, of course, all of the hard work of public health, the community that we've put in during our COVID-19 pandemic response. And in addition, all the sacrifices that have been made, right? All the number of hours away from our families, and just the continued work that we continue to do in public health at the care center across our agency. And so I just want to recognize public health and all of the maybe not direct public health heroes, but public health heroes that have put their hats on this past 18 months. And the fact that we have many people that have never worked in public health, but have truly stepped up in ways that are truly beneficial to our community. So I just want to extend that word of thanks and gratitude to everyone in our community that has continued to stick by public health and have continued to be advocates during this important time. Last week, we received several announcements from Governor Walz. So I'm going to walk through those announcements as I had to track these. And I'm not sure how much information you all get on a daily or weekly basis, but it felt like they were coming in daily. And so I'll just start with last Tuesday. Governor Walz announced that more than 4,000 students 5 to 11 years old had received their COVID-19 vaccine at 19 school clinics that were held in Minnesota since November 3rd. When the age group became eligible for the vaccine. In addition to the school vaccine clinics hosted in partnership with MBH, local public health departments are hosting more than 100 school vaccine clinics between this month and next month. And of course, we'll continue to do that throughout the year. Last Wednesday, the governor announced that the federal government accepted his urgent request for emergency staffing assistance at Minnesota's hospitals. And it sounds like the Department of Defense sent 2 teams, medical teams, to hospitals to relieve doctors and nurses as they treat COVID-19 and other patients. Now, these teams were deployed to HCMC in Minneapolis and to St. Cloud Hospital. I'll just mention that I think this is going to be an ongoing issue across our state. And so we'll just pay close attention to kind of where these medical teams may be redeployed to, also in our own county, but just across the state. And so it looks like 22 medical personnel, were sent to support these 2 areas. Yesterday, the governor announced that he is taking action to support Minnesota's long-term care facilities and is activating the Minnesota National Guard to form skilled nursing response teams that will provide support to long-term care facilities that are experiencing staffing shortages, and also proposing to provide $50 million in federal funding to facilities to help with hiring and retention of staff. So this is really important as we see staffing shortages on people that are impacted by COVID, not only the residents that we're serving in these facilities, but also our staff. Very long hours, very stressful situations. So the skilled nursing facilities that are at risk of staffing shortages, as I mentioned, can access this new funding and staff support in consultation with the Minnesota Department of Human Services and the Department of Health. And so more to come on that, but I wanted to share that important information as each and every week, I think we mentioned the stress that our long-term care facilities are experiencing during this time. Finally, the governor announced that Minnesotans 18 plus that are fully vaccinated who received the Pfizer and Moderna vaccine at least 6 months ago, or the Johnson & Johnson vaccine at least 2 months ago, are eligible and encouraged to get a booster shot. So that was the last announcement, I think, as of Friday. So a lot of announcements coming from our governor and also our MDH partner. I'll just kind of leap over to some local updates here in our county. Here in Ramsey County, we continue to offer boosters at our sites, which we started on October 9th. As of Monday, November 22nd, we have given 822 booster shots, right? This past week, last week, and then as Incident Commander Anderson mentioned, into later this week, we will continue to provide support for on-site vaccine in our Ramsey County community sites and also at our pediatric school sites. And so we'll have 4 of our reoccurring community sites that will continue to provide vaccines, and 4 of our pediatric school clinics will also be doing the same. As of yesterday, we have given 1,272 pediatric doses at our sites. Just a reminder that we started giving those pediatric doses on November 10th. So we're rocking and rolling there, which is great because as Incident Commander Anderson mentioned, we want to see that percentage go up, right, of fully vaccinated people in our community, including our kiddos. Last time I checked this morning, now this may have changed, there were appointments that were available at our sites, both Como Elementary and Battle Creek Elementary. And so there are some appointments, I think, left today, community, if you want to get in at Como Elementary and December 6th. And then November 23rd and 30th at Battle Creek Elementary. Our community sites are full at this time for the appointments that are listed. Last Thursday, we mentioned that we were going to do a vaccine pop-up event. And so I just really want to extend a huge thanks to our trusted partners. We were fortunate enough to be able to work with our trusted messengers last week to spread the word about that Thursday afternoon vaccine pop-up event where we were able to serve 180 people, both children and adults. And I just want to mention, Madam Chair and Commissioners and County Manager, that reach out happened very quickly and we filled those spots very quickly. And so we want to continue to replicate that model, as Incident Commander has mentioned before, really addressing the issue of equity as we distribute vaccines in our community, making sure that we are reaching the folks most impacted by COVID, our community, our diverse community members, zip codes, you name it, right? Age ranges that we know are in need of vaccines. So we're really grateful for that partnership. One other thing I want to mention this morning is that we've mentioned this a few times, I think, coming out of the summer. How do we reach whole families? How do we rev up to meet the needs of families and caregivers who have children 5+? So public health is partnering with communications to roll out a vaccine or COVID-19 vaccine media plan that will be implemented over the next 3 months. This media plan will focus on reaching families with kiddos 5+ in the county to drive vaccination rates. We'll also offer, which we've done in the past with our Trusted Messenger initiative, offer specific prevention and mitigation messaging, especially as we move into the holiday season, right, and move indoors. So that's going to be really important. And as we start kind of these cold weather months, right? And then one other thing I want to mention is the importance of testimonials and stories, right? That personal touch and hearing from community. And so we're also working on a few testimonials and videos to dispel misinformation. And this work is not only, this didn't come out of, I would say this came out of a partnership with our EAC Healthcare Committee, where we're lifting up those key recommendations that came out of that committee at least a year ago, right? And so we've been working to dispel misinformation and to Even Dr. Ogawa's conversations that she has around myths, right? Breaking those myths around COVID-19. So we want to continue to do that, but do that with community voice in mind. And so we're gonna work with communications to get that media plan in place very quickly. Lastly, our COVID-19 response team continues to address the ever-changing conditions, right, affecting capacity and demand. And so we're going to continue to offer those boosters or third dose operations. We are seeing an increased demand, as I've mentioned, at the dedicated community clinic site. So we're navigating that on a day-to-day basis to see where do we have capacity to expand our reach. And then, of course, we'll continue to get out those pediatric vaccinations at all of our school and community sites. So that wraps up my update this morning. So I think Dr. Ogawa, you have maybe a few things to mention, and then we'll stand for questions. Thank you.
Thank you, Director Holly, Madam Chair, Commissioners. I was actually just going to speak briefly. I know last week we touched on how to stay safe during the holidays, but I think especially the fact that Thanksgiving is Thursday, that I sort of wanted to organize my thoughts a little bit better and give the message. So first and foremost, we definitely want everybody who can be vaccinated to be vaccinated. The best way to protect all of those around you and yourself from hospitalization and ultimately and unfortunately death from COVID is to be vaccinated. And for those individuals who can't be vaccinated, or for those individuals whose vaccination may or may not be offering as much protection, those who are immune compromised, those who are elderly and haven't received their booster yet, it's especially important for those around them to be protected and vaccinated as well. The other issue is that with transmission being so high, and the fact that the vaccines, we cannot say protect 100% against transmission, for individuals who are at high risk, if you are gathering, you may want to really consider wearing, at least having them wear a mask, and possibly others wearing a mask as well. The other issue is, the other important part about mitigation is testing. We have tests relatively readily available, both rapid and ones and PCR that take a couple of days. Being tested before you're going to be around someone, and then also making sure that you aren't around new people between that time, is also very helpful. The test gives us somewhat of an indicator of whether or not you're symptomatic to begin with. And so if you test right before you go, you are less likely to be symptomatic, and it's negative, you are less likely to be symptomatic, even if you were to be recently infected. Also, following other recommendations, windows open, lots of fresh air. As much as we want to spend extra time with our family, limiting that time is better in the long run. Then also, if you can meet outdoors, it's going to be, I believe, 10 or 20 degrees though on Thanksgiving. So it may be really difficult to meet outdoors this year, but meeting outdoors would be helpful as well. Those are just some of the recommendations that I wanted to remind people of. The other issue, or the other thing that I would recommend, is after gathering, being tested. The recommendations now from the CDC are after potential exposures, testing it really closer to day 7 now. They think that we're catching more cases then. And so between 5 to 7 instead of 3 to 5. And that is a little bit of a shift. So if you're around a number of individuals over the holiday weekend, or people who you don't usually see, it's probably a good idea to test about 5 to 7 days after Thanksgiving as well. I already see some hands up for questions. I will take a break, and we're all available for questions at this time.
Thank you all. Yes, go ahead, Director Holly.
Thank you, Madam Chair and Commissioners. I just want to mention that I think a special guest showed up at one of our clinics the other day. And so the Saints Madonna showed up at one of our clinics. I want to give a shout out to Commissioner Fretham for that connection and idea. And so, I just want to mention the incredible work and partnerships that we have in public health and the work that we're doing. I mean, just our first clinic, we had fun things for the kids to do and to engage, and those testimonials that you're going to see soon from communications are of our kids and our families. And so I want to thank Commissioner Frethman and all the commissioners here for your continued reach into community and your voice around COVID and advocacy. But I just wanted to give that word of happiness. There's so much happening, right? That just some hope that we can hopefully get through this together is so important. So thank you, Madam Chair, for allowing me to interrupt briefly, but I wanted to mention that this morning.
Thank you so much. And thank you to Commissioner Fretham for the ingenuity of the connection. We appreciate you so much. I do have 3 questions from commissioners or 3 comments, and I'll call first on Commissioner Reinhardt.
Thank you, Madam Chair. Well, first of all, I wanted to note that, excuse me, my grandchildren are actually getting their vaccines today. They are very excited. And it's relatively easy to get, even if it's not through Ramsey County's sites, relatively easy to get the appointments to get the vaccination. So they are incredibly excited about that. And their mother is going to get the Pfizer booster today as well, and the flu shots, the regular flu shots. So it's just going to be a healthy day for the Reinhardt family here. And it was interesting because I know, Dr. Ogawa, you talked before about the fact that at this point, the Pfizer is the only booster that's available. So regardless of which shot you got to begin with, that you can have the Pfizer booster. And I think that that's a really important message to get out there, because my daughter-in-law had the Johnson & Johnson vaccine. I also wanted to commend, and before the meeting started today, I commented on the fact that my husband plays General Waverly in White Christmas at Lakeshore Players Theater. Fantastic play, check it out. But what I wanted to talk about there was what Lakeshore Players is doing to protect their staff, the people that are in this play, which is a lot of people on stage at one time, and the community in general. They have put in place you must have a proof of vaccination or a negative COVID test within the last 72 hours to be admitted to the theater. And it is an absolute. And you can do what we did because at that point, the grandchildren weren't vaccinated. We did an at-home test and were able to provide the data to them. In addition, they are requiring masks throughout the show, from the moment you walk in until the moment you walk out. They are not serving concessions because they do not want to have people taking their masks off. Other than, going out and getting a drink of water. While you're getting a drink of water, you can take your mask off. And I think that it really shows the respect that the folks out in our community have for each other and the love that they have for each other, because it's about everyone in the community and stopping this spread. And when you listen to the numbers that you have provided, it is scary. But there's also a way to deal with it. And there are safe ways to have the Thanksgiving holiday. I don't think that we're going to go outside at 10 to 20 degrees. But the fact is, even within your own home, you must take those precautions. And so I know that there are a lot of other businesses and workplaces that are taking these same precautions. But I just want to point out that it's really, it shows respect. It shows respect to be able to put these in place so that everyone can stay as healthy as we possibly can during this high transmission rate. So with that, I just wanted to note that, again, we're in this together. And the fact that the information that we receive every week through our community health, Dr. Ogawa, Director Holly, and all the others that are involved in this, that really are making sure that we're doing the very best that we can to keep people safe. So I just encourage folks that are listening, get your boosters, get your shots. The 5 to 11-year-olds can now get their shots, and we all know that. And to really, if you have a question, I guess this, this goes with anything that we do. If you have a question, rather than just taking things at face value, especially through social media, ask the question. Question it yourself. And so those myths, we need to dispel those, and I know that our staff is doing a great job in making that happen. Thank you.
Thank you very much, Commissioner Reinhardt. I'll call on Commissioner Ortega.
I'm sorry, I apologize for interrupting Chair Carter, but I wanted to clarify something really quick. It's true, when I spoke last, Pfizer was the only booster, but all of the vaccines now have boosters available. However, having said that, they are all mixable and matchable. And so again, the best booster to get is the booster that you can get soonest. And so, but the other vaccines are available. Pfizer is actually also the most, it seems the most available right now in the community. So, but I just wanted to clarify that, that all of them are available.
Thank you, Commissioner Reinhardt, for the comments, and thank you for the clarification as well. Dr. Ogawa, I was going to make you a commissioner today. Commissioner Ortega.
Thank you, Madam Chair. My question is, we're doing a great job, but as that chart has shows, I think we were doing better than most of the county in terms of immunization and so forth. But still, as we all know, it's we're not out of the woods. I think last week we were the #1 state in the country with the increase. A lot of the constituents are asking me questions that I keep bringing to you guys, and that is, the latest one is, with everything that's happening in Europe in terms of countries shutting down, and in the past that has been a precursor to what happens in the United States. So now I think there's a lot of concern as we keep vaccinating more and more people. Where are we in the context? I don't know how those other countries are doing vis-a-vis us. Are they vaccinating at the same rate, et cetera? But I guess the concern that I keep hearing more and more, if Europe is shutting down, or countries within Europe, does that mean, is it coming to us eventually, as it has in the past?
Sounds like that's a hard one.
Looking at each other, Madam Chair, Commissioners, Commissioner Ortega, it's hard to tell. I think when, just the issue of shutdown, right? Like we're not under those emergency orders as of, August. And so I would just say, we're going to continue to monitor, particularly in our county. But as you mentioned, like the whole state is, essentially red right now, with maybe exception of like one county. But and day to day that changes, right? So I would just, to all of our residents listening, and even to your responses, and thank you for sending us those emails and those questions. It really helps us provide, updates that are relevant to our community members. But I think just continued mitigation, right? That's going to be the thing that we have to really lean into. And as Dr. Ogawa mentioned, as we congregate inside, I kind of shivered when she mentioned, let's go stand outside at 20 degrees, right? But it's true. We really want to limit our gatherings. And so as of, I kind of feel like we're back to last year, right? When we were sending out those messages around, masking, limiting your gatherings, testing right now. But right now we have vaccines available to us. And so I would say, as, providing that update around the governor's, push and our push and the Commissioner of Health's push to keep people out of the hospital, right? Out of our ICU beds, right? So that we can continue to provide general care, but also care for patients that are coming into the hospital related to COVID. It's going to be really important. So I would just say, Minnesota may be right now in the red, right? But my hope is that with continued vaccines, as we see our children get vaccinated, as we move into the spring months, that hopefully with mask wearing mitigation and the continued policies that the county has to ensure that people get vaccinated and wear their masks, right? That we can kind of see that downward trend happening. But right now we're just in this spot, and it's very concerning. And so we appreciate everyone's effort here to get us those messages that come in from community, and we'll continue to provide the most up-to-date information each week. So Laura or Dr. Ogawa, I don't know if you have anything else to add.
The only other thing that I was going to add is that we definitely know, if we look at the maps over time, that this higher numbers hit across the northernmost area of the states. And that's likely because it is true. We're going inside, and that's where we know transmission is significantly higher. The other issue is in public health, when we flatten the curve, unfortunately, it doesn't mean that we make all the cases go away, and we may even delay some of the cases. And so some of what we may be seeing, and I like to believe that it's that we are doing a good job. We delayed our spike, and we're flattening it, and we're keeping individuals out of the hospital, and we're keeping as many individuals from dying, but it's not 100%. So that's another issue that I believe we're seeing, is that we're seeing our delay because hopefully we're getting vaccinated and we're doing the other mitigation and we're slowing spread.
Thank you.
Yes, and thank you very much. Commissioner McGuire.
Thank you, Madam Chair. And of course, thank you all of you for all of your work, Director Holly and Dr. Ogawa and Lieutenant Commander Anderson, for continuing on. I know this gets to be a lot, but you're just still continuing all your hard work and all of the staff that's working on this. So thanks to everyone. I have a question, Dr. Ogawa, about the testing, and you've stressed that that's a really good thing to do, like right before you go, but then 5 to 7 days after you've gone, and I appreciate all of that. Because it's not always that easy to get all these people to go to test. You know, my brother's actually bringing, I think, a pile of tests to our Thanksgiving dinner so he can hand them out. But is that okay just to buy, in mass these home testing units? Is that as good as going in and getting tested at a place? Can you talk a little bit? I know you've talked about this before, but just affirm or confirm for me what the efficacy of these home tests are, because that's about what I think we're going to get our family to do. But yeah.
Chair Carter, Commissioner McGuire, I can speak to the differences in the tests. Most of the home tests, actually all of the in-home tests, are what we call antigen tests. So they do not actually test for the virus or particles of the virus itself. So in general, they are not as sensitive as a PCR test or one that is run in a lab. So when you ask me, is it as good as, I can't say yes to that. The other issue is that I'd like to mention this in most of the times when I talk to the public too. All of these tests are actually operating under an emergency use authorization, similar to our vaccines. So in other words, none of them have full FDA approval yet either. So we have to be careful. And part of it is because we never had a pandemic like this before from COVID. So many of these tests are still being, quote, tested as we go forward. What we do know about the antigen tests is, unfortunately, I'll just share with you, they can be as low as 40% sensitive. So it's possible that they could miss 60% of cases. That's a global answer. Many of them have shown that they can also be as much as 90% sensitive. Most of those occurred with symptomatic individuals, though, and that's when we think the viral load in our nose is highest. So we do need to be careful. Before you don't take that test, though, it's still, if that's, an option, it's still a reasonable test to take when you're going to be around individuals. And so I think it's a reasonable test. We also utilize those tests repeatedly in settings, in some congregate settings, because the more we use those tests repeatedly, we also think their sensitivity increases. So it's a reasonable test. It's not as good as PCR or a lab run test, but it's reasonable. There are also, I'll just mention, and I could go on for a long time, but I'm not gonna, I promise. There are point of care, what we call point of care PCR tests available as well. There's a couple of companies that are making them. We think they're more sensitive, but we still don't know yet either. So there's still ongoing tests for that as well. But in general, a quote PCR test is more sensitive than an antigen test. And the test should tell you which kind it is. So I hope that was helpful and not too long-winded.
No, that's really helpful. Thank you, Dr. Ogawa. It's just occurring to me, I just know that we need maybe more testing sites then. I mean, otherwise I think people are going to the home test, and if they're not as efficacious, is that a word, efficacious? Then I don't know. I'm just thinking about needing more testing sites, but okay, thank you.
I think we could certainly use more testing sites. In the meantime, I think what we're hearing from Dr. Ogawa is some testing is better than no testing.
Yeah, right.
And so blessings for your holiday. I have a couple of pop-up questions, and then we're going to move on to the balance of our agenda. Commissioner Reinhardt.
Thank you. And I, when I was talking about the tests that I gave to my grandchildren, it's not the first time they've taken that test, but the fact of the matter is, and I don't know if there's a difference between the tests or not, but I do know that when we went to the Roy Wilkins auditorium at the River Center, that it was literally the same box. It was the same exact test. And so it wasn't like it was something that was totally different. So the home tests and what you would get there, and that's what most of the people were getting at the testing site as well. Because if you're not symptomatic, generally that's what they would suggest. And that's just what I experienced when I was there at the actual testing site. And the other thing was, you know, it wasn't the first time I had that test either. And I know that Public Health, Dr. Ogawa, Director Holly, at that time said, if you have, even if you take that test, because it's something that you have that's immediate, if you're not symptomatic, especially, if you become symptomatic, that you should immediately go and get the additional test, even though that one says negative. So it's really, you know, more than a one-step process. And I didn't mean to make it sound like it was, okay, well, that was great. That's all we had to do. That was the only thing we could do. But again, the tests that are at home are generally, I would think anyhow, even if it's not the same brand name, but that's what I happen to have, was the same brand name that they had at the testing site as well. So they're not different in the different testing sites or at home. And they are relatively simple to do. So I don't know if you want to, Dr. Ogawa or Director Howell, want to speak to, are the ones, is there a difference in the home tests?
Dr. Ogawa?
Chair Carter, Commissioner Reinhardt, I think you probably saw the Binax test. Those are actually done by local company. Yep. So the Binax antigen tests, regardless of who runs them, are the same tests. It's true that whether or not, but they're both antigen tests. The PCR tests, though, that are run at Vault by Saliva are different tests.
Right.
Yeah. So those are the PCR tests the state is utilizing at their sites the Binax tests as well, as sort of a way to increase the number of people who can be tested as well, and the rapidity at which we get the results back. And that's too, is when we do testing for a disease or an infection, we want to balance sort of quote gold standard, but if that test is too difficult, takes too long, we want to look for newer options that mean we get almost as good results, but faster.
Thank you. I appreciate that. I'm going to call in Commissioner Ortega, then we're going to move on. Commissioner Ortega.
Yeah, quick question, Madam Chair. Dr. Ogawa, you stated that none of the vaccine are FDA approved yet, right?
I'm sorry, Chair Carter, Commissioner Ortega. The Pfizer vaccine for 18 and over is fully FDA approved. All of the other vaccines are still under an emergency use authorization. And Pfizer is actually still under an emergency use authorization for anyone under the age of 18. Okay. So I apologize if that was confused. Pfizer does have full FDA approval for initial series for those over 18.
The reason why I asked the question is because some of the folks I've spoken with who have not gotten vaccinated, I've heard this over and over again. Well, I'm not taking it until there is full FDA approval. And so I guess part of my question would be is, so while we're using it under emergency use, so I get it, you get it, but there are people that are not getting it at all. They haven't even gotten their first shot because they're waiting for the full FDA approval. So my question is that still in progress? I mean, are we moving to getting that full FDA approval?
Chair Carter, Commissioner Ortega. Yes, actually, Moderna and Johnson & Johnson have requested and turned over all of the data to the FDA for full approval, even for them. Also, Pfizer has turned over, I believe, a fair amount of data to get their full approval brought down in age. I'll mention something else, and that is that all of the same studies have been done on these vaccines that would warrant full FDA approval. It is really just the FDA reviewing that data and giving the stamp of approval. And I don't mean to say that that's light at all, but the same kinds of studies that we do for full approval have been done and are ongoing. And so if individuals are waiting for the full FDA approval, I understand, but Pfizer has been granted that, and Moderna and Johnson & Johnson have requested that and turned over all of the data to the FDA, and the FDA and ACIP just need to finish meeting and reviewing that data to offer the full approval. I hope that's helpful.
Thank you.
I think that is very helpful. Might I just ask, because I hear the same kinds of concerns and reasons for not getting vaccinated. Is this kind of information easily accessible on our FAQ, on our website, somewhere that we can point to so that we can say to people, if you're concerned about getting vaccinated, take a look at the site in an easy to understand fashion? Can we refer?
Madam Chair and Commissioners, I would just say, I don't think there is such a thing as easy to understand vaccine information through the CDC and Yale site. And I don't mean to say that doesn't mean we shouldn't keep trying. I think our most effective outreach has actually been the person-to-person outreach from public health to individuals in those conversations.
Yeah.
And it gets to Director Holly's earlier comments about needing to be out everywhere and anywhere in the community, because you can answer questions differently than you can read it. That being said, we do link to the most up-to-date information that is available to the CDC that flows back through MDH and that ties into our information. We'll keep doing what we can. The reality is we are learning as we go. And while we believe everything to be very safe, the idea of knowing whether or not boosters would be recommended, we didn't even know 3 weeks ago. And so it's that kind of thing where we need to be open to the idea that learning more doesn't undermine the information, but yet requires us to be in a constant dialogue. I hope that helps, and we'll keep updating as we can.
It helps, and I appreciate the work to continue updating as we can. We all want to be able to share as much as possible, and getting clarity here from Dr. Ogawa in this way has been extremely helpful. We recognize all the work that our team is doing, and we appreciate, because the results do show, we're not proud of the current rate of spread, but we are very thankful for the work that you've been doing to keep it as low as we possibly can. As it shows, it reflects in our dashboard. Thank you so much for this update. We could ask questions all day, but we won't, because we do need to continue in our work. And so I'm going to check back in. I think the county manager may have a couple of comments to make before we move on. County Manager O'Connor.
Madam Chair, I'll just close by saying, when we saw earlier from Incident Commander Anderson, the rates of transmission spread throughout the course of the pandemic, the red bar or the red line on that graph that is Ramsey County shows Ramsey County typically as the lowest county in the metropolitan region for case rate spread. In the most densely urban populated county, in the county that in many ways demographically has the highest risk of spread for COVID. And that shows the work of the public health officials in our organization and every public health professional in this work. It shows the support of the board following public health advice. We don't have all the answers. We have not been able to stop COVID, but we have been able to mitigate it. And time shows that now over the last 2 years, and we will continue to do what we can.
Again, all our gratitude and thanks for the work of our staff every day and with our community to mitigate this extreme risk in our community that is the COVID-19 pandemic. We'll move on to our administrative items after a 30-second or so break for a moment of meditation. We'll take that now. Thank you. Commissioner Ortega, would you take us through the administrative items, please?
Yes, Madam Chair. I move item number 5, agreement with the University of Minnesota for 4-H youth development programs. Item number 6, amendment to the agreement with Legal Services for Juveniles, Inc. Item number 7, reappointment of the Ramsey County Medical Examiner and amendment to agreement for forensic services. Item number 8, Public Works Construction Quarterly Report for July 1st, 2021 through September 30th, 2021.
Second.
Thank you very much, Commissioner Ortega and Commissioner McDonough, for the motion. Are there any comments or questions on the administrative items? Then we'll ask the clerk to please call the roll.
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
and Carter.
Aye, thank you very much. The entire administrative agenda has now passed, and we'll move on to ordinance procedures. We've had the opportunity to get through public hearings.
Madam Chair,
Yes.
I believe we do have a policy item first. It kind of sneaks onto the bottom of that page and the top of the next.
I'm sorry, thank you. I really appreciate your pulling me back there. We have a policy item presentation, and I will call on you, County Manager, to get us started on the presentation on funding for workforce programs through the American Rescue Plan Act. There is no vote on this item today. It is for information only, and it will return to us for a vote on proposed workforce solutions funding for American Rescue Plan Act. County Manager.
Thank you, Madam Chair. And I thought you'd want the presentation on this one. It's been in the works for a while, and it's important work to continue our efforts around responses during the American Recovery Plan Act. In the context of the large buckets of work coming back before the board, I think this is the last one you're going to see for a while, as we've been methodically working our way through those different tiers of priorities. And my goal will be to work with the CFO to ensure that when this comes back at the first meeting in December, to hopefully be acted upon, we'll bring in the full summary of exactly where funding has been spent and what that all looks like to paint that fuller picture exactly. Today, we're focused on workforce initiatives. These impact both members of our community as a whole and also thinking about Ramsey County as a major employer within this region as well. I'm joined by Director Ling Becker to get us started. And so without further ado, I'm going to move it over to her.
Good morning, Madam Chair, County Manager, Commissioners. Thank you so much for the opportunity to talk to you this morning about our efforts to invest American Rescue Plan Act dollars in workforce programs and services. This morning, I'm going to talk briefly. I'm going to share my screen here. Are you able to see that?
Not yet.
How's that?
There you go.
Okay. I'm going to share briefly about a few broad areas around investment, and then we are going to get into details around two particularly more timely efforts. Joining me this morning is also Director Tina Curry and the team she's been working with on a public health career pathway for county employees. And so we'll be discussing that as well this morning. And then we'll lay the foundation. Yes.
Before you get started, you're in presentation mode, I think, or presenter mode. If there's a way you could pull it in so you just have the one slide showing up at a time, that might be helpful.
Yep. Let's see here.
Ling, I could also share from my screen too, if needed.
Ling, this is Sarah. If you go into display settings, right at the top, it should offer you the opportunity to switch it.
Got
it's
it.
Not.
You got it. That's
it.
I
got it. Okay. All right. Thank you. Sorry about that, everybody. So let me go back here. So today we're gonna be talking a little bit about kind of our past investments and how they're gonna propel us into like the next efforts that we have to make. So again, thank you to all of you and so many areas of this organization who have supported workforce efforts throughout the pandemic. We've supported over 10,000 residents between the many programs from our career labs, our tech packs, nearly 100 contracts with community partners. Those investments came in the form of the CARES Act funding, and then most recently our American Rescue Plan Act dollars in our partnership around the Right Track Plus program with the City of St. Paul. As a quick update, that program has concluded this past week, and I want to thank Commissioner McDonough for joining us in a closing session for 212 young people who completed their internships in 94 unique employers with that program. So thank you to the City of St. Paul for their ongoing partnership. And this effort really demonstrated the need for community partnership that we need in order to think about rebuilding a more inclusive economy, and also a strong focus on maximizing our relief dollars by leveraging our collective efforts. So as you're aware, Ramsey County operates workforce services supporting the needs of all our communities. This partnership and effort means that we are engaging with organizations throughout Ramsey County. Our work with the Suburban Ramsey Family Collaborative, the multiple school districts, higher education partners throughout the county, and more. And it is through these connections and residents that we have gained more understanding about the needs of job seekers as well as employers. So thank you to many of you who have come along with me as we've met with the community, whether it's with employers or with cities and chambers throughout this past year. So over the past months, I've been working particularly closely with the staff at the City of St. Paul to ensure that we have the opportunity to collectively contribute and to make a shared investment into our community, recognizing that the city has received almost $172 million in ARPA funding. This type of collaboration and co-investment will ensure that we are being the best stewards of our funding serving our shared residents. The mayor of St. Paul has proposed to spend $40 million of their ARP dollars on workforce and business supports. The workforce projects are taking shape and investment amounts for co-funding are being identified. And I plan to bring you those details in early 2022, either through another policy discussion like this or a board workshop, but I do want to give you a broad overview today. So our ongoing investments align with the county's tiered priorities. In addition, we want to make sure that we are continuing to address the disparate impacts of COVID-19. So as a gauge, our investments center on addressing racial disparities, recognizing the policy links recommendation that I have here on the screen. Every city and county in this country faces the challenge of eliminating racial inequities. And every city and county should use these recovery resources to remove barriers for full participation and proactively advance racial equity and inclusion. And so we've called out our projects particularly to focus on a couple of these priorities, to connect unemployed and low-wage workers with good jobs, and also to invest in frontline COVID impacted and disinvested communities. So at this time, I want to give you a broad framework as to why these initiatives. I've spoken to many of you and to the community in various settings on the disproportionate impacts of COVID-19. By the factors of race and ethnicity, age and education, those folks have been hugely disproportionately impacted, and we need to ensure that our ARPA efforts are always working with a racial equity focus. We also want to align with labor market information. Commissioner McDonough and Commissioner and Chair Carter recently joined our Workforce Innovation Board, and we heard a excellent presentation regarding the future job growth in Ramsey County. And due to the COVID-19 pandemic, the majority of the unemployed population were coming out of low-wage jobs. And workers in these, what we call opportunity jobs, should pivot to what we have now identified as target jobs. And these are occupations that have related skill sets to these low demand jobs, but however, have accessibility to the target jobs through accessibility of training and shorter educational pathways, and have a high wage potential. So as we think about all this work, we also want to acknowledge the people side of this work and of economic growth and recovery and resiliency. Many of you have heard me say this, and it's one of the most proudest things I talk about when I talk about my role here in Ramsey County, is the intentionality around workforce solutions being in the EGCI service team. We recognize the opportunity and potential of the human assets of our community toward economic growth, which are diverse and rich and typically undervalued. However, as the county of the one-of-a-kind economic competitiveness and inclusion plan, we see our diversity as our greatest economic strength. So you will find that many of the investments that I'm going to be talking about are an activation of the economic competitiveness and inclusion plan, particularly calling out areas of creating earn and learn programs. We also call on deeper partnerships with employers, and certainly continuing to invest our COVID relief dollars into workforce programming, all of which were called out in the economic competitiveness plan. So the priority projects are as follows. Our proposed ARPA workforce priorities will continue to focus on those who've been disproportionately impacted by the pandemic. In the next round of requested funding, as we work closely with the City of St. Paul, there will be a foundational strategy rooted in earn and learn models. At the most fundamental level, earn and learn allows participants to earn a wage while completing training. Those wages are critical for our residents, as many need income in order to take the time to invest in themselves. We have plans to create pre-apprenticeships, apprenticeships, internships, and on-the-job training programs that will do just that around target occupations which are middle skill career pathways with high growth and high wage demand, and an assurance of a family sustaining wage, and education that requires a 2-year degree or less. In addition, the disproportionate impacts of the pandemic on our youth and young adults is something that this county has acknowledged and attempted to mitigate with so much of your previous investments. At many tables that I've been at, and certainly you've been at, there have been ongoing focus on investing earlier in our young people, particularly upstream, ahead of young people being involved in county systems. Our next round of priority investments will provide an opportunity to truly align a coordinated youth employment ecosystem that will include more collaboration between the county and city to build upon the work we did this summer that goes well beyond Right Track. Rather, we will create, intersect, and lead a county-aligned youth employment and career readiness ecosystem that will include our alternative schools, our school districts, our CBOs, and many others. Our work will include creating a one-stop digital hub of resources that will be youth created through a tech media career pathway. We'll create intentional supports for justice involved, foster and homeless youth, while working on eliminating the areas of highest barriers, including driver's licenses for our young people. So maybe I want to pause there before we pivot to the 2 more immediate requests. Chair Carter?
Thank you very much. We appreciate this overview of the background and the priorities and the reasons for moving into the priorities as you've listed them here. I'll ask for any questions immediately as we intake what you've shared before we move on to the 2 specific requests. And if not, and I'll pause just briefly, if not, I would just state that we are very thankful for the work and investment this past year with our CARES dollars and for the attention on these priorities as set forth, particularly for the work that you have done with youth and for the priorities that you've listed here that take us into ways in which we can ensure that our greatest needs in moving through and beyond pandemic are met. It is important that we certainly address equity as an essential element of our needs and opportunities, and the recognition of our diversity as our greatest strength, I think, is a hallmark of our work moving forward. I see no questions from the board at this time. I'll ask you to move on then to describe the 2 immediate requests.
Thank you, Chair Carter. So as I mentioned, today we're going to bring forth 2 projects that we hope to follow up with a request for board action in December. I will start today talking about the Ramsey County Early Childhood Academy, and then I will turn over to Director Curry, who to discuss the Public Health Career Pathways program she has been leading. So as many of you know, the childcare industry has been one of the biggest impacted throughout the pandemic. Childcare and early childhood educators were frontline workers. They were declared an essential industry. They had to pivot and change while the whole community needed them. Childcare centers had to reduce their numbers, operate in a safe manner while struggling to get PPE. Our county responded under the leadership of Commissioners McGuire and Fretham to form a policy action group that helped to identify some of the biggest challenges. That group helped to make connections with key stakeholders and legislators and has really served as an opportunity for us as a county to further clarify our internal and external roles and alignments, supporting early childhood care and education. You're going to get a chance to hear more about that work at a county board workshop in December. However, I want to focus in on particularly the workforce needs today. The American child care crisis is decades old and continues to be disproportionately affecting women and low-income families. The gaps here are another area of the pandemic that has been illuminated by the pandemic, and there are and will be continued pressures to improve childcare and early education systems in order for us to make a robust economic recovery, and certainly for there to be an inclusive economic recovery. We are seeing the need for more workers right now for available jobs. Many of you know where our employers are at in terms of their need. And we also know that a lot of people need training. And both of these things are going to require that families have access to high quality, affordable childcare. Throughout the rounds of relief funding at the federal and state levels, there has been a gap in supporting employees working in early childhood education. There is possible new funding being identified right now in the Build Back Better legislation. And while we've been tracking this with our government affairs team and our community partners, the industry is in a crisis that actually cannot wait. Any support we provide now will ensure that any longer term funding that becomes available will then be invested in what is more of a robust ecosystem that will be more ready to serve families with particular needs around our culturally specific childcares and our childcare deserts in this community. We know that the workforce needs to reflect the community that they're serving, and currently that is very challenged at this time. So here are some statistics about where we are in terms of the worker need and the impacts. You see so many people need childcare services. 1 in 3 US workers have children and 75% need childcare services. Childcare workers are disproportionately female, they're young, they have high school diploma or less. They tend to be, they're represented by Blacks and Hispanics at 15 and 10%. The average wages are extremely low. They're making about $12 an hour in our community, and that is a big challenge for the industry. As of November 1st, there were almost 100 childcare jobs in Ramsey County posted on Indeed. Through ARPA funding, we hope to have the opportunity to create a Ramsey County Early Childhood Academy to support current and prospective early childhood workers and support new high-quality childcare businesses in the county. Our investment will ensure more people who are working in the field stay in the field through the ability to gain professional development and providing scholarships for a child development associate credential. Investing in these workers ensures that we will have more high-quality childcare providers in this county. Our efforts will have us partnering to ensure that we are promoting this as a career path for as well as those who've been impacted by COVID-19. In addition, we'll test new innovative pilots or wage subsidies, particularly for parent-aware designated centers and those located in childcare deserts in our diverse neighborhoods, while also providing small business support for those family, friends, and neighbors in order to become high-quality licensed childcares in our community. We anticipate serving 300 residents over a 3-year period. With this ARPA investment, we anticipate being able to create an additional 420 slots in Ramsey County and saving another 975. And I will preface that in our conversations with Think Small, that is a great partner here in this community, in the last 2 months, we've lost more slots in Ramsey County than we did the rest of the year in 2021. So we know we are at a breaking point in this industry and help is needed. So with that, before I turn over to Director Curry, maybe this would be a good time if you have any questions for me, Chair Carter.
Thank you very much, Ling. We really appreciate this description of the Early Childhood Academy. I want to say thank you also to Commissioners Fretham and McGuire for their leadership of our policy advisory group and for the development of support. We can't have a build back better focus of getting people back to work without having childcare workers and without providing quality childcare for our parents and families. So thank you very much for putting this before us. I see the participants, the slots created and the slots saved and the investment over 3 years. And I just want to applaud the presentation of this work. I do see a couple of hands up. I will call on Commissioner McGuire and then Commissioner Fretham. Thank you both. Commissioner McGuire.
Thank you, Madam Chair, and thank you, Director Becker. Oh my gosh, this is just so exciting. I just can hardly wait for us to get this going and really really address the crisis that we do have in childcare, in the childcare industry, especially in Ramsey County. I just want to thank you, Madam Chair, for your leadership in this. Commissioner Fretham also for being an early instigator of this work, and all of us on the board who have been just so supportive instigators in our own right of the early childhood work, and especially in childcare now. So, and want to thank all of our partners. The Child Care Policy Action Team has just had amazing support from all of our community partners. And Director Becker mentioned Think Small. But there's so many partners that have just been, helpful in this work. So I am really excited to, help move this work forward, whatever we can do. And just thank you, Director Becker, for just bringing this forward and getting this work going. So I appreciate it. Thank you. Thank you, Madam Chair.
Thank you, Commissioner McGuire. Commissioner Fretham.
Thank you, Commissioner McGuire, for starting us off on this. This has been such a fun project to work on with you. And thank you, Director Becker, for your efforts. I'm so grateful that we were able to bring you into the PAG. I think workforce and the business aspects of childcare are often overlooked in our conversations about increasing access and affordability. And that people don't see how that drives some of the issues that we have in our childcare infrastructure here in Minnesota, and how many of our family childcare providers, love what they do so much that they don't necessarily think of themselves as a business person or a business owner. So being able to invest in the workforce aspects of childcare and invest in our people that provide this critical service that make it possible not only for many, many parents, including myself, to work, but also to ensure that children are having experiences that are safe, healthy, high quality, and prepare them for kindergarten. That this is such a great place to invest funds because of the return we get now in terms of getting people back to work, and the return we get in the future as these children start school prepared to learn. So thank you.
So thank you very much for those comments. I'm going to turn it back to you, Director Becker. Oh,
Madam Chair,
sorry,
I just thought of another question. If I could just ask Director Becker just to clarify, or not to talk about a little bit about, if we get additional dollars, we're going to use some of our American Rescue Plan dollars for this now, and we're also looking for Build Back Better dollars that are hopefully to come. And some people wonder, well, will we, still need to be doing this with Build Back Better? And just if you could comment on the need for this, no matter what happens with Build Back Better. I mean, we're going to continue to need this academy.
Madam Chair, hey, Wayne, let me suggest one other piece to it. We formed, Commissioner McGuire, we formed a countywide working group. It involves legislative staff, finance staff. It'll involve group members from EGCI, Health and Wellness, and others as well, specifically focused on the infrastructure bill, as well as the Build Back Better, whatever comes out of that. I think it's important to note that there's lots of ideas, but none of it's real till it's real. And on the infrastructure side, we're prioritizing that to understand what's in the bill, what does it mean for Ramsey County, where do the opportunities lie? That group's just getting off the ground, and it will be a group that can track some of this as well. I would say this early childhood initiative will not be impacted by the Build Back Better bill. We're suggesting this needs to happen now, regardless of what happens in other places. The other pieces that Director Becker mentioned that aren't coming forward yet, but we're trying to reserve workforce funding for as we seek alignment with other partners, that would include the feds and isn't fully vetted yet because we're trying to buy a little more time to make sure we understand the ecosystem, where it may not be quite the same level of crisis yet. Lane, do you want to add anything to that? I just wanted to make sure I set that broader context.
Yeah, thank you, County Manager, Chair Carter, Commissioner McGuire. I think we are in a crisis, and this will prepare us to be able to receive those resources. We're going to preserve, hopefully, and create additional culturally specific childcares that then could be funded through some of these programs that will come. I mean, this money will take a long time, even if it gets passed. It will start at the state, and then they will have to build a plan. And by then, we will have lost a lot more slots. And so I think, if anything, this will set us up well to serve the communities that actually need to be served through that Build Back Better some of those programs. They are giving priority for folks who are in low income areas. And so we want to make sure those areas are resourced with childcare so that if they do end up getting scholarships, there's actually childcares in their neighborhoods that they could actually access. And then lastly, I think we'll provide a good model to the state. I mean, I've been in conversations, and I know Commissioner Bretham has helped us introduce folks at DHS, but I mean, this is going to be a way to see what might work. I mean, we need to start doing some innovation faster. And I think at the local level, we can do that a little differently than sometimes the state can. So hope that answers your question.
I'm so grateful for that. Thank you so much. And I just told, thank you for your innovation and creativity. And right, I'm not surprised that Ramsey County would lead for the state to follow, in showing how this can be done. And I'll just say that I've got my community, my visitors association, who's in Roseville. They were looking for childcare for their workers, for all the housing that's going up there. They want childcare in those areas, and so we are just anxious for this work to be done. So thank you so much for that.
Thank you, Commissioner McGuire. And I'll just note that we're using Build Back Better as a verb and as a noun to talk to programs. And I thank you for getting ahead with this proposal. I'll turn back to you, Director Becker.
Yeah, thank you, Chair Carter. At this point, I'll turn it over to Director Curry to talk about the public health pathways.
And I say thank you so much for being with us, Director Curry. I see we have a number of people on the line. It's great to see this partnering as we look to building the resources that we need for our community. Thank you for being with us, Director Curry.
Good morning, and thank you, Madam Chair, Commissioners, and County Manager O'Connor. Before I begin my comments, I want to thank my collaborative team that is working alongside me. That would include Director Becker, Director Holly, Ramsey County Pathways Coordinator, Noelana Gates. I have to give them a huge shout out. Registered nurses and community health workers are needed for the health, safety, and well-being of our community due to the declining public health workforce infrastructure. Unfortunately, we are experiencing labor shortages in these areas, which are critical to our COVID response and community well-being. The Public Health Career Pathways Program is a unique professional development initiative designed specifically for frontline staff in entry-level positions as an opportunity to connect them with better paying jobs so they can move up the economic scale to cultivate prosperity. This program aligns with the county's talent attraction, retention, and promotion work to retain and promote diverse and talented staff to meet the needs of our community. The public health workforce need. During the past decade, nationally, the public health workforce has decreased by 56,000. Many factors have contributed to the decline, including some retiring, others leaving because of the risk of the job, and some leaving because of COVID-19 burnout and fatigue. It is estimated the U.S. will need over 1 million new nurses by 2022 to avoid a nationwide shortage. Registered nursing is the most in-demand job in the state of Minnesota, according to the Minnesota Department of Employment and Economic Development. In Ramsey County, we are experiencing a shortage of registered nurses in our correctional facilities as well as social services. On the community health worker side, it is projected there will be nearly 16,000 community health worker openings each year for the next 10 years. The program design includes 2 public health career pathways, one for registered nurse and one for the community health worker. The registered nurse pathway leads to an associate's nursing degree, which meets the requirement for someone to test for a registered nursing license in Minnesota. The community health worker pathway leads to a community health worker certificate. The community health worker track will launch January 2020 and the nursing track the fall of 2022. St. Catherine's University offers a 9-month community health worker certificate and is our educational partner for the community health worker track. Our goal is to have our nursing partner confirmed in the coming weeks. The goal is to support 10 staff on the nursing track and 20 staff on the community health worker track. Support includes tuition, books, transportation, technology assistant, incidental expenses for transportation or childcare, mentoring, and other related academic supports. The cost of the program is $1.1 million.
Director Curry?
Yes.
I'm sorry, I don't have my slide papers in front of me. Are you moving on to another slide or is this the completion?
Yes, next slide.
You good? Next slide. There we go. Oh, I'm sorry. We got lost. How about Tina? You just keep going. We'll find the slide here in a second.
That is the next slide. It's
Okay.
Ling's slide.
Okay, so
Madam Chair, I'm sorry. Ling, are you going to say anything else here to finish the comments before we go to final questions or what?
Yeah, I can do that. I didn't know if there were questions directly for
No, let's
around
tie
the
it up.
public.
Let's wrap it up, get to the end, and then
Okay.
we can talk about it all holistically.
So while we're moving forward, I've had a question come up from Commissioner McDonough. Let me call on Commissioner McDonough. Thank you.
Thanks, Chair Carter. Tina, just wanted to get a sense, the program costs $1.1 million. You've identified a number associated with the nursing program and community health worker. What's the time span on this to help support these folks with this $1.1 million?
Thank you, Commissioner McDonough, Madam Chair. The time span is 3 years, the duration of the program.
And that would I got to go back to the slide. I think you actually identified numbers attached to each one, like 20 nurses or something. And that would help support that cohort all the way through. You would be bringing in new cohorts along the process then. Or would you be bringing in? I'll pose it as a question.
Commissioner McDonough, Madam Chair, the plan is to pilot with the first cohort of 10 community health workers. Then we do a second cohort of 10. So that would get us to the total of 20 community health workers. And then we'd also start with the 10 nursing.
Perfect. Thank you. Good work.
You're welcome.
Thank you very much. I know we look forward to hearing more about this, including how, in fact, you will be selecting and supporting these people who would enter into this pathway. I appreciate your looking at our entry-level workers and the manner in which we can also help to facilitate movement toward prosperity. Thank you. I'll turn back to, thank you, Director Curry. And now I'll turn back to Director Becker for the completion.
Yeah, thank you, Madam Chair. So this is just to outline some of the next steps. The expected funding request for the full ARPA workforce investments is going to be $9.5 million. We're going to do a request for board action before the end of 2021 around the 2 specific projects you heard about today. I plan to come back to you either in a board workshop or presentation in early 2022 to discuss the remainder of the 9.5 that is being co-invested and co-created in partnership with the City of St. Paul's ARPA dollars. And then lastly, I wanted to call out a project that we've been working on through the Economic Development Administration. That's part of the Commerce Department. As a part of the ARPA legislation, there were multiple areas where different agencies in the federal government received relief funding. And so the Commerce Department has 6 large grants that are being made available regionally for communities to apply for. And there is one opportunity called the Good Jobs Challenge. And so I've been working pretty feverishly with the city of St. Paul, the city of Minneapolis, and Hennepin County to form an alliance to bring regional dollars here around 3 sector pathways in technology, healthcare, and green construction. And so in order to be the lead applicant on that grant application, we will need to bring before you a joint powers agreement for your approval. I've talked to our CFO, Alex Kutza, and she's been willing for the Ramsey to be the fiscal agent on that project. And so when you see the JPA, that will be reflected. And I'm happy to answer any other questions regarding that as well. I anticipate the request for that will be in the range of $20 to $24 million for the region.
Thank you very much for this presentation. I did not intend to skip over it. I'm glad that County Manager caught me at the right time to do that. I'm looking for any additional questions. I see Commissioner McDonough's hand is still raised. I don't know if that's a new question, but I'll call on you.
Yep, thanks, Chair Carter. It is a new question. Elaine, could you talk a little bit, when I first read this and reviewed it last week, and I got to this slide, and I was getting a little concerned and tried to sort out in my head, are we, because you're coming to us later with more detail and the proposal, my concern was, are we just picking a number and then we're building a program to the number? Or are we building a program and then taking a look at what it takes to actually fund to get the results we're expecting? We had a chance to talk a little bit about that, but maybe you could just go a little bit deeper into what's coming, especially in the partnership with the city. Mayor Carter announced $40 million, you acknowledged that at the beginning, and partnering with them and what that potentially would look like. Because I just want to make sure that as we're moving forward on ARPA dollars, and I know it's always a balance, right? Because there's such a demand and need sometimes, and so we just pick a number and then we say, do what you can with that number, versus actually really taking a hard look at what do we need to accomplish, and then what are the resources we need to help support that. So maybe talk about that balance, the partnership with the city ARPA funds, work leveraging our ARPA funds as we move forward on this.
County Manager, did you want to start, or do you want me to go ahead? I saw you.
Madam Chair, Commissioner McDonough, I'll say a few things. We are hitting the point in the allocation where, I would say, I think that Director Becker would tell you we could go farther than 9.5 million if more than 9.5 million materializes. I'll give voice to that and say, in the list of priorities that came through, there were reasons we started where we did, and we're trying to now prioritize the most core functions of what we can do within the workforce space that we can, and 9.5 million is a comfortable number we can carve out to do that work. And this is the first cut of that as that conversation continues into next year. I am hopeful that in the resulting continued efforts with DEED, with our Department of Economic Development, Employment and Economic Development, the state, and the federal work, we continue to actually see opportunities to go farther, as well as in those partnerships that Director Becker mentioned earlier. But I do want to give voice to, we could spend $20 million if we had $20 million. It's definitely not that. It's constrained by the fact that the county received the funding that it did, and affordable housing and violence prevention take up large shares of that funding out of the gate. And I appreciate the question. It's a good one.
Yeah, Commissioner McDonough, Chair Carter. I've been working really closely with the city of St. Paul for weeks, and we've been trying to build out a set of projects that really do meet the needs of the things that I described to you in the first part of the program, around those labor market information, around learning and earning, around the framework of our economic competitiveness and inclusion plan, and most importantly on, I feel on this whole realigning of the youth ecosystem. I feel like this is a fair amount based on the conversations that we are co-creating. There certainly might be some workforce things that the city may or may not find co-investment from us. We've held on to the premise that it needs to fit the county's strategies around the frameworks that I've laid out here to you. And but we want to make sure that we're working in close partnership because we share so many of the same residents, and many of the folks that actually need these services are involved in other county systems. And so this opportunity to really leverage our money is very difficult. I know some of you have talked to me and I've expressed how hard it is, and yet it is the best way that government should be working, and it's worth every blood, sweat, and tear that we are doing, because it truly is demonstrative that we are being the best stewards that we can, and that we are collaborating and we're leveraging, because we don't all have the same resources. We don't actually all have the same ways to connect into, for example, as we grow the public pathways, there's different jobs in the city of St. Paul that we should be pathwaying into. There's other jobs in the county that they should be, right? And so I think the Right Track Plus was a very small demonstration of where we can go together. And I've been working probably for 3 years on the perfect timing for this kind of relationship to materialize. And I think we have a commitment from the mayor's office and from a very committed city council as well. It is hard to somebody's got to put money on the table first. And, we're dancing to different policy schedules and different political realities, but I guarantee you that we are pushing hard, that this needs to be a co-invested model, and that it needs to be one that's very much informed by county priorities and our leadership and workforce solutions.
Good. Madam Chair, if I could follow up, please. Yep, thank you. I appreciate that, both Ryan and Lang. And, we'll look forward to what comes to us here early next year about, being able to pull all that together and what that looks like in that true partnership investing. A couple of quick comments. I've been involved in workforce even before I got onto the county board. But early on, I recall the old CETA program, right? And some of the things that we really tried to do with kids. And they were really good kind of headline photo op pieces, but they were really low value, low impact for our kids. They really, truly were. And I think one of the things that we started with the CARES funding, Ryan, this is kind of a intermingled piece here, but that evaluation piece that goes along with the investment piece to really demonstrate to the community, yes, this is a lot of money. And we are really trying to make sure that we have high value, high impact with these investments in the areas that we've picked as our priorities, and to be able to demonstrate that. I pay attention not only here locally, but with, my colleagues across the country, both cities and counties, and you see different approaches, but I see so many approaches where it's really more about kind of the access or who's speaking the loudest. And they're just doling out the money, kind of like who got there first. Well, let's fund this today, and we funded that tomorrow. And I really appreciate the thoughtfulness that Ryan, you and your team have put into the bigger holistic plan, the 5 tiers, the 5 levels. I appreciate, Ling, your work in your area coming forward with, the first request, like 24 hours after we got our money and got it into it. And I was able to be a part of that celebration and see that. But, the big thing here is and it's hard work, it's complex, but we really need to make sure that these investments are high value for our kids, or anywhere we're putting in, in the homeless money, the violence prevention, and have a high impact in actually changing the direction or changing culture or changing norms within our community. So maybe, Brian, just touch briefly. I know, after we got the CARES money and we had all the evaluation presentations, what we can expect as far as evaluation with the ARPA money. And really, Ling, I appreciate your efforts and really always coming back and attaching it to the county's priorities and values when you're working with partners and trying to move them along so that we do better than, and Commissioner Reinhardt and Commissioner Ortega, you were here when, Mayor Kelly took his $400,000 back, and he gave kids garbage bags and he put them on the street corner, and that was it. And it was like, this is just not right. We can do better with our money to help support our kids for a better future.
Thank you, Madam Chair, Commissioner McDonough. The request for board action, the board recently approved included funding for holistic evaluation across all the various ARPA investments being made. That was an important part of that discussion and all of these constituent parts. I would just note on the side that Director Becker is working very hard to ensure all investments, county investments and aligned investments, are seeking that highest and best value impact, the long-term impacts as well as the short-term impacts. And that's an important lens through which we are viewing all of this work. We may learn things along the way about what is and isn't successful, and our pledge is to keep talking about that out loud so these investments feel as though they were smart and guide better decisions going forward.
I want to thank you very much again for the presentation of these upcoming requests and also for the overview of the manner in which we are attempting to align and also take best advantage of the resources that we have in leveraging together. We may not all have the same one-to-one match in the work that we're doing, for example, with the city and its ARPA funds, but we do know that we are able to partner and to work effectively on behalf of our entire county. And that's what you've shown us you are working dedicatedly to do. Thank you very, very much, Director Becker, also Director Curry, for being on this call. And we will look forward to this coming back to us as we march forward toward these investments. We do have a little bit of time left for our ordinance procedures, which I tried to move us onto in the first place. And so we will go to our ordinance procedures. Again, having had our public hearings, we have 2 ordinances before us for approval. We'll start with a motion in a second to get item number 10, amendments to the Ramsey County Administrative Ordinance on our agenda for discussion.
So moved.
Is there a motion? Thank
Second.
you. Thank you very much, Commissioners McDonough and Ortega. Is there any discussion on amendments to the Ramsey County Administrative Ordinance? Thank you. Having had our readings and also our public hearing, we appreciate that we can call on our clerk for the votes. Thank you.
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
and Carter.
Aye, thank you very much. The amendments to the Ramsey County Administrative Ordinance have now passed, and we're moving on to item number 11. That is our 2022 Capital Improvement Bond Ordinance, again, for which we've had our readings and also our public hearing. Is there a motion and a second?
Move approval.
Second.
Victoria.
Thank you very much, Commissioner Reinhardt. And I believe that was Commissioner Fretham. Nope, Commissioner Matas Castillo. Thank you. And so we have a motion and a second. Is there any discussion on the Capital Improvement Bond Ordinance for 2022? Thank you. We'll ask the clerk to please call the roll.
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye. Aye.
and Carter.
Aye, thank you very much. And the 2022 Capital Improvement Program Bond Ordinance has now passed. We are moving on to county connections. I'm going to call on the county manager, but we have very, very precious little time left as we're attempting to get to a workshop by 11:15. County Manager O'Connor, County Connection.
Thanks, Madam Chair. I'm going to fly with some good news. Last Wednesday night, the County CARES Act funded Tech Pack project received the 2021 Techne Award in the Tech for Good category from the Minnesota Tech Association. These awards have been around for 24 years. It's the premier celebration of innovation and achievement amongst leaders in the state's technology industry. This is a big deal and a recognition of the work that's gone on here in Ramsey County to bridge the digital divide during a time when that is extremely important. And another piece of follow-up on this, we have launched a new tech equity page on the Ramsey County website that talks about our work to organize, think about, and implement efforts around tech equity. It can be found at ramseycounty.us/RamseyConnected. ramseycounty.us/ramseyconnected. We will share that information with you as a follow-up to today's board meeting in writing. Congratulations to Workforce Solutions, Communications, and all the other partners who have been a part of the Tech Pack work, as well as the launch of the Tech Equity page. That should include policy and planning for sure in that as well. Two other quick notes. Yesterday, Director Schenecker sent you all an email about a University of Minnesota capstone project report on health equity in county transportation here in Ramsey County. This will be an important part of our work moving forward as it evaluated different areas that contribute to health equity inequities in the Ramsey County transportation system, including structural racism, air pollution, car-centric planning and design, incomplete built environment, and extreme heat. So please go back, make sure you get a chance to look at that report, familiarize yourself with it. As we talk about all abilities transportation and our work moving forward, this will be a big part of it. Thanks to the University of Minnesota and our Public Works Department and Policy and Planning again for playing a coordinative role in bringing it all together. And finally, on Tuesday, December 7th, many of you will be joining the Statewide Association of Minnesota Counties for the annual awards banquet. And I'm here to get to announce two exciting awards that you may want to be extra enthusiastic about. First, our 2020 Census and Voter Engagement work in Ramsey County will be receiving a County Achievement Award for its innovative work to engage the community, expand democracy to every corner of our community, and ensure everyone has a voice. And then secondly, in the area of AMC Outstanding Service, Deputy County Manager Kathy Hadeen, formerly the Public Health Director at the beginning of COVID, will be receiving an AMC Outstanding Service Award. And that is an excitement for us all to get to announce. And she represents so many during this pandemic and the leadership and work across Ramsey County that while being in a hurry today, I was not going to stop without getting to give that kudos to her. And we look forward to celebrating with the group from the Census and Voter Engagement and Deputy County Manager Hadeen specifically on December 7th. Thank you, Madam Chair.
You did a fantastic job of reporting, and we are celebrating in our emoji screens. And so thank you so much. We're going to see what a good job our board can do as we collect essential reports and head toward our workshop. Let's see, I will call first then on Commissioner Reinhardt.
Thank you. Well, this last week has been a very busy one, and most of it has been around the environment and climate change. So I will quickly go through those. But actually, the first thing I want to talk about is the Ramsey County Library Board meeting and how exciting it is that we have reached an agreement and we're moving forward, and the hopefully the executive director position will be posted soon as we move into the strategic planning process for the library board as well. So there's a lot happening there. It's exciting and really walking hand in hand with the library board to make sure that we can better meet our vision, mission, and goals. From a environmental perspective, I participated again in the Climate Smart Municipalities initiative, which is with between the city of White Bear Lake and a community in Germany and a lot of people from across the state, local elected officials especially, and state legislators are on it, really talking about the circular economy and what we can do to impact, which we need to do obviously, is impacting in a positive way and making changes for climate change. The National Association of Counties, Resilient Counties Board also met, again, talking about coming back from COVID and about really the infrastructure that we have in the United States from the county's perspective on resiliency and impacting climate change. The EPA administrator had an update on WOTUS, and not everybody's going to know what that means. In fact, very few people know what that means. It's Waters of the United States, and it's about making sure that our waters are drinkable, fishable, and it was pointed out recently to me that I don't think scuba is a word, but that people could do
scuba diving in Minnesota, which I didn't realize. I guess it makes sense. Anyhow, but we want to make sure that our waters are really safe for generations to come. Minnesota, by the way, is so far ahead of other states in this area that the actual WOTUS rules that are being put forward right now don't have a lot of impact on Minnesota counties because we are that far ahead. But it is still important for our country, our nation, our world. And then finally, I am vice chair, of the Clean Water Council Policy Committee, and we are working through positions, policy positions on things related to climate change, but specifically on things that are impacting waters, which is things like PFAS and other contaminants of emerging concern. Thank you.
Thank you, Commissioner Reinhardt, for adjusting quickly. I'm going to ask board members who are remaining, if you have essential reports, please do. Otherwise, let's try to hold until our next board meeting so that we can get into workshop. Thank you. Commissioner Fretham.
Sorry about that. I obviously was so busy putting my list together. Thank you.
I apologize.
No essential reports. Thanks.
Thank you. Moving on then to Commissioner Matas Castillo.
No essential report.
Commissioner McDonough.
I'm in. No essential reports.
Commissioner McGuire.
Sorry, I'm almost in, but I gotta say a couple things. I wish I could contribute. Anyway, just to say that the House Bonding Committee came, and almost all of us were a part of some presentation last Wednesday. I think it went really well. So thanks to everyone for the Bonding Committee's tour of Ramsey County, St. Paul, and our community presentations. Just a couple of upcoming events that I just want to make people aware of, and I will save everything else till next time. But the Ramsey County League of Local Governments is having their annual meeting, which you're all invited to. That is Thursday, December 9th. I know it sounds far away, but it's in a few weeks, and it's going to be at Maplewood Community Center. Justice Alan Page and Aline Chimroff are giving a presentation on the amendment of, to make the amendment. I want to make sure I get it to the concert that will provide all children with a civil right to quality public education. I think many of you have heard about this, but anyway, it should be good. That's the Ramsey County League of Local Governments. And then, as has been mentioned, we have our Association of Minnesota Counties annual meeting in December. There will be an awards banquet, and I hope that everyone's able to be at that. As far as NACO, our National Association of Counties, we have our large urban county caucus meeting coming up and our board meeting. And also, I just want to say that there's an inaugural prenatal to 3 county leaders academy that is being started by NACO. It's a really exciting thing, and I'm speaking on a panel on that at the meeting coming up. And it's just great to be a part of a county leaders academy for prenatal to 3. So thank you, Madam Chair.
Thank you, Commissioner McGuire. And finally, Commissioner Ortega.
No report, Madam Chair.
Thank you very much. I will forego my report as well. My apologies. We do want to get into a workshop. We will only have 5 minutes upon the conclusion of this meeting so that we can get into the workshop quickly. And that workshop following our county board meeting will be on growth and change in Ramsey County, lessons from the 2020 census, and it is available as a Zoom webinar. With that, we will take 5 minutes. It is now 11:13. I hope that you can be back on screen at 11:18. Does that work in the chamber? Thank you very much. And with that, we are now adjourned.
So this next part is not televised.
me.